So it's my pleasure today to introduce Ella Rydz. She is with CAREX Canada. She is a senior research associate there in Toronto. She's coming to us from across the country. Her interests lie in occupational exposure assessment, including exposures to pesticides and shift work, as well as the impacts of sex and gender on health. She is also interested in mobilizing occupational exposure and cancer research through accessible tools, materials, and collaborations. Previously, Ella worked at the Occupational Cancer Research Center, where she mobilized estimates of the burden of occupational cancer and coordinated a radon survey of workplaces in Ontario. She has a master's in public health, in environmental and occupational, and a master's in public health in environmental and occupational health from the University of Alberta.
Okay, great. Thanks, George, for that introduction. Today I'll be talking about CAREX Canada's estimates of occupational exposure to pesticides among agricultural workers in Canada. And in particular, I'll be talking about three pesticides: chlorothalonil, glyphosate, and 2,4-D. Let me see. There you go. Just a brief overview of the presentation. So I'll ease into it with just some basic definitions, and I'll talk a bit about some of the uses of pesticides. I'll cover pesticide sales in Canada, and then I'll talk a bit about its carcinogenicity, and then I'll talk about the approach that we use to estimate occupational exposure and the methods that we used and the results. So pesticides are formulations that are used to control, destroy, or inhibit the activities of pests and to minimize their injurious, noxious, or troublesome effects. And a full pesticide formulation consists of a whole bunch of inner ingredients that are things like water, solvents, emulsifiers, surfactants, but also active ingredients, which describe the specific chemicals that are responsible for that pesticidal action. So examples of active ingredients are like glyphosate and 2,4-D. And active ingredients, they're regulated by the Pest Management Regulatory Agency, which is part of Health Canada. And generally, PMRA, they're responsible for conducting risk assessments, registering pesticides for use in Canada, and outlining what the acceptable uses are. So on what crops they can be used, in what context, and the different application methods. They do evaluate pesticides on a 15-year cycle. So every 15 years, they're revisited for registration. And currently within Canada, there are 7,500 products that are registered for use, which amounts to approximately 650 active ingredients. And so, of course, we know that pesticides are used to control, kill, and repel pests, but they actually have many other uses. So they can be used to regulate plant growth. So they can change growth patterns without actually being toxic to a plant. So, for example, it might be administered to wheat to decrease the overall height of the plant, but to increase stem thickness. And what this does is that it may increase crop productivity by reducing the risk of lodging, which is just when the stems bend. And then it also increases the efficiency with which the crops can be harvested. Pesticides can also be used to stabilize nitrogen levels. So they can prevent losses of nitrogen fertilizer, and they can increase the efficiency with which nitrogen is used by the crop. They're also used to desiccate crops. So this is usually done before harvest. It helps the crops mature at an even kind of level across the field. And then it also helps to increase the efficiency of harvesting. And so these various uses lead to many benefits that are kind of listed there on the right-hand side, including increased productivity, reduced labor requirements, and also enhanced produce aesthetics. And so this brings me to the first poll question. So approximately what percentage of total pesticide sales in Canada in 2018 do you think were due to agricultural pesticides? And I think that poll should be popping up soon. Okay, and there it is. So we'll just give it a minute for people to respond.
Yeah, when we get too close to 80, I'll end the poll.
Thanks, George.
One or two trickling in. We're almost there. Okay.
Just 2% away.
So there you are.
Okay, great. And then the results, do I need to share them now, or they're showing?
I will share the results.
Okay, perfect. So yeah, most people said 70%, or I guess half the people said that, and that is the correct answer. So approximately 70% of the pesticides sold in Canada were agricultural pesticides. And what I have here is data from the Pest Management Regulatory Agency. So on the y-axis, we have kilograms of active ingredients sold, and this is from 2008 and 2018. And we see just generally that over time, sales have been increasing, and that this is mostly driven due to agricultural pesticides. The PMRA does also include some data for domestic uses, and we see that it comprises overall a very low proportion of total sales, and also non-agricultural uses, which the PMRA defines as pesticides that were not used in agricultural or domestic kind of sectors. And most of these are used in water treatment and also wood preservation. In this slide, I thought I would just show to illustrate how the breakdown within the different sectors is quite variable. So within the agricultural industry, most of the pesticides are herbicides followed by fungicides, whereas within the non-agricultural area, it's mostly antimicrobials. And then within the domestic sector, or for domestic uses, it's a bit more varied again, with antimicrobial use being the highest, followed by herbicides. And so who's exposed in the agricultural industry? I think many of the occupations that come to your mind, they are those who are exposed. So those include farmers, farm managers, pesticide applicators and sprayers, farm workers and harvesters, and they're exposed through multiple sources. So they can be exposed when they're mixing, loading, or applying pesticides. Also during the storing and cleaning of pesticide equipment. And oftentimes workers that are involved in these types of tasks are exposed to higher levels, just because this involves working with the undiluted form of the pesticide. So typically with the pesticide formulations, you add water and then you put it into the device before you apply it. So they're dealing with that concentrated form. Exposure can also occur during drift. So a person may be applying pesticides in the field, and depending on the wind conditions, or maybe even the type of nozzle that the applicator is using, if it produces a fine enough mist that can be easily carried away by the wind or in the air, then bystander workers could be exposed. And workers are also exposed when they re-enter fields that had been previously sprayed by pesticides. And they might be re-entering for a number of different reasons, just to do with the general maintenance of the crop, to do scouting, to assess if there's been any damage, that kind of thing. And so the primary route of exposure is through skin contact and inhalation, but also, and to a lesser extent, oral ingestion. And so this brings me to the organization that I work for, CAREX Canada, and I wanted to introduce us so we can kind of illustrate why we were interested in this. So we're a group of researchers and based out of Simon Fraser University, although we are scattered across Canada. But what we do is we look to identify what carcinogens Canadians are exposed to at work and in the community. And we're interested in where they're exposed, how many, and to what extent they are exposed. And really, our ultimate goal is to inform efforts to reduce Canadians' exposures to known and suspected carcinogens by providing a body of knowledge about Canadians' exposures to carcinogens. And we look to support organizations in prioritizing exposures and in developing targeted exposure reduction policies and programs where possible. And so in 2015, we undertook a priority setting exercise. So I wasn't at CAREX at the time, but Dr. Cheryl Peters led this initiative. And the goal was to establish priorities for preventing occupational cancer through the production of exposure estimates and descriptive profiles. So what Cheryl did was she looked through a large list of carcinogens and then prioritized which ones we wanted to update the estimates for or create new ones for. And she prioritized them based on 4 criteria that are listed on the slide here. The first is the presence or use in Canadian workplaces. We wanted whatever estimates we created to be relevant to the Canadian context. The second is toxicity, and the team looked at both carcinogenicity and other health effects. And so CAREX, typically we do look to the International Agency for Research on Cancer's classifications when we are looking at a substance's carcinogenicity. And for those who are not familiar, they classify substances based on their hazardous or carcinogenic potential into 4 different categories. So group 1 is definite carcinogen, 2 is probable carcinogen, or 2A. 2B is possible carcinogen, and 3 is not classifiable. Cheryl and the team also looked at the feasibility of creating new estimates because we do rely on available data. And finally, they considered special interests from the public or scientific community. And as you can see on the right-hand side, the table that I pulled from her publication, pesticides did end up being a high priority for estimate production. And part of the reason is that around this time, well, first of all, pesticides are very extensively used in the Canadian workplace, but also because around this time, the International Agency for Research on Cancer was evaluating for the first time or reevaluating a number of different pesticides, and some changes were occurring that was making this very topical. And so this brings me to the second poll question. So this one's a bit long, I'll read it out. The International Agency for Research on Cancer assesses the carcinogenic potential of hazards. How many pesticides as of 2021 were classified as definite carcinogens, meaning they had sufficient evidence of carcinogenicity in humans? This feels more like trivia.
So I'll launch.
Thank you.
Looks like we're getting some quick responses.
Mm-hmm.
Oh, look at that. All right. And I will share the results.
Perfect.
It's like a horse race.
Yeah, so lots of people thought greater than 10 and 4 to 6, which is interesting because very few carcinogens are actually considered definite carcinogens. So this is a table that I adapted from a presentation by Dana Loomis, who's from IARC. And I added the last 2 columns. What this table shows is the number of pesticides by IARC classification. So I updated it by including the 2021 values or findings. And what I found was that, and what's happening at the time, is that a lot of pesticides were kind of being classified in the higher levels, just moving up towards the 1 and 2A. So there was quite a bit of movement there. I've added that last column for those who are more interested in the specific active ingredients. But even so, I know there's a lot of concern about pesticides, but actually not that many have been classified as definite carcinogens yet. And this kind of just speaks to, limited human evidence of carcinogenicity. And here, these are the 3 pesticides that we decided to focus on for our study. And the reason we chose these 3 is because they are the top selling pesticides in Canada that had been evaluated by IARC. And so I'll provide just a bit of context on all of these. So glyphosate is one that you may have heard of. It's the main ingredient in Roundup. And it's actually been around since the 70s, but it didn't increase in popularity until the 90s or 2000s when they developed glyphosate tolerant crops. So there are a few of them now, including soybeans, corn, canola. And what that means is that you can apply glyphosate to the crop without damaging it. And in Canada, the sales are huge. Greater than 50 million kilograms of active ingredients were sold in 2017. And IARC classified them as a group 2A probable carcinogen with limited human evidence of non-Hodgkin's lymphoma and sufficient evidence of carcinogenicity in animals. 2,4-D is another herbicide that we included. The sales are less than glyphosate, so 1 to 5 million kilograms of active ingredients. And it was classified as a possible carcinogen by IARC. And they had inadequate human evidence. They mostly looked at non-Hodgkin's lymphoma there, and there was limited animal evidence and strong mechanistic data. And finally, we also were looking at chlorothalonil, which is a fungicide. Similar sales to 2,4-D, although that is quite a range. And they were also, chlorothalonil was also considered a group 2B carcinogen and on the basis of strong animal data. And so IARC conducts hazard assessments, and I thought I'd just cover some of the epi data. I'm mostly just here pulling from the agricultural health study. I had to narrow down somehow. So the agricultural health study, it's a large prospective cohort of pesticide applicators and their spouses from Iowa and North Carolina. It was initiated in 1993 and it is ongoing. And it's quite large. It has over 50,000 licensed private pesticide applicators who are mostly farmers. But it also has 30,000 of their spouses and additional 5,000 commercial pesticide applicators. And they collected a lot of different kind of exposure data. At the onset of the cohort, like the beginning, they collected information on past and current use of 50 pesticides to various levels of detail. And then at the 5-year follow-up, they also asked open-ended questions about crops cultivated, animals raised, pesticides used in the most recent year of farming. And here I have just some mortality findings from the agricultural health study. And I just wanted to include it to show that the findings there are pretty consistent with the broader literature that farmers and agricultural workers have overall decreased mortality, but increased mortality due to some specific causes. And here, what they found was that all-cause mortality was lower, but there is decreased mortality due to cardiovascular disease, cancer overall, diabetes, but increased mortality due to some specific cancers listed there and due to machine injury. For the pesticides that we're looking at, they have conducted some studies as well. So the team conducted 2 studies looking at glyphosate, one in 2005 and one in 2018 in response to the IARC classification. So this second study added an additional 11 years of follow-up for a total median of 17.5 years. And they also increased by 4 times the number of glyphosate exposed cancer cases. They looked at a few different metrics. So only the first study looked at that first one listed there, ever, never, mixed or applied, but both of them looked at cumulative lifetime days of use and intensity weighted cumulative exposure days. But for the second one, they didn't find any association with solid tumors or lymphoid malignancies, but they did find some evidence of increased risk of acute myeloid lymphoma. These are very preliminary findings, and they suggest that this needs to be looked into because it hasn't really been seen before. So that's kind of a very quick overview of that study. The team also looked at chlorothalonil. And they followed cancer incidence up until December 2004. The exposure metrics are the same as well. And they considered almost 50,000 applicators, 4,000 of which had used chlorothalonil, and they didn't find any association or trends for overall cancer incidence or for colon, lung, or prostate cancers, which are the cancers that they had adequate numbers to evaluate. Oops, I forgot to change my slide. I'm sorry about that. We'll move on to the next one. So this brings us to kind of our approach for how to estimate agricultural workers' exposures to those 3 pesticides. And so what we did is we reviewed available data and tools in Canada and abroad, just to get a lay of the land, to see what we were working with. Then we developed a pesticides advisory committee to help guide the method development. And finally, we finalized the methods and applied them to the 3 pesticides to demonstrate feasibility and see what the results were. And so what we found was that there's not a lot of good quality pesticides use or sales data. So we have the Pest Management Regulatory Agency sales data, but it's very high level. What I've shown you is kind of as detailed as it gets, and you saw that even so it's a bit loose, as in the sales data for chlorothalonil and glyphosate, they provided quite a range, and for chlorothalonil and 2,4-D, it's a range, and for glyphosate, it's upwards of 50 million kilograms of active ingredients. So difficult to work with. Some provinces do collect use or sales data, but it's difficult to use this data to create national estimates of exposure because they're collecting either use or sales. They consider different industries. So some of the provinces actually exclude the agricultural sector, and they just use different methods. So it was too difficult to piece together. Data on agricultural workers, operations, tasks, and crops worked are also not very much available. So we actually ended up having to pull from some of the data from the United States, particularly on tasks worked by agricultural workers by crop. But we did find some population level estimates of occupational pesticide exposure. And these are from international CAREX systems from the Latin American region. Yeah, so we had data from Costa Rica, Nicaragua, and Panama, and the type of information that they incorporated differed slightly. The Nicaraguan CAREX estimates for pesticides were based on the Costa Rican estimates, so it was a bit more similar. But for Costa Rica, what they looked at was proportions exposed, which they obtained from, in the paper, they say university data banks, and it's not entirely clear to me what that was. I think maybe it was some maybe exposure measurements that they then were able to calculate proportions exposed. But they also heavily relied on expert opinions on the number of workers per hectare by crop, the proportions of farms using pesticides by crop, and also data on aerial spraying. In Panama, they drew from agricultural labor force data. They estimated cultivated land areas and also frequencies of pesticide application. And so using this, they estimated the prevalence of exposure by calculating the average number of people in agriculture per sprayed land area. And then for our pesticides advisory committee, we had experts in cancer epidemiology, exposure assessment, and GIS, methods development in occupational epidemiology. And these are the 6 individuals that were part of the advisory committee. What we did is we met 4 times over 1 year. So in that first meeting, we presented the data that we found and potential options for how to proceed. And then our advisory committee advised how we should proceed. And then we kind of had an iterative approach where every time we would bring something to them, we would receive their feedback and try to come back with something a little bit stronger, or to at least address some of their concerns. So it was a pretty good process. And then moving on to the methods. So this is just an overview slide. I'll go into detail about each step in the subsequent slides, but I thought it'd be useful to take a step back and see the bigger picture here. So first, we established the number of agricultural workers by farm type. Second, we estimated the number of workers who are at risk of exposure. Third, we assigned likelihood of exposure. And then finally, we assessed exposure among agricultural workers with missing information. So that one might not make that much sense, but I'll explain it. I did want to point out that these methods and results have been published in the Annals of Work Exposure in Health. So if you are interested in reading about it in a bit more detail, do check it out. Although there is an error with the first author, so just keep that in mind. So step one, establish the number of agricultural workers by farm type. We pulled from 2 different data sources to do this. Both of them are from 2016. So the first is the census of population. And the reason that we wanted to use this data source is because most of our other estimates are based on the census of population, and we thought it would be good for comparability's sake. But the issue with this data source is that data are available for farms overall. So it's a bit higher level than we wanted. And also the census asks for workers' main jobs. And for this reason, we suspected that it excluded seasonal, temporary, part-time, or migrant workers, which we know play a large role in the Canada's agricultural sector. And so for this reason, we also drew from the Census of Agriculture. And it has data available by farm type. The Census of Agriculture surveys all census farms in Canada, and it asks about all farm operators and paid agricultural workers. So we were happy to see that they were getting captured there. We did still want to use the census of population though. So what we did is we calculated the relative proportion of workers by farm type using the Census of Agriculture, and then we applied it to the Census of Population, the overall number of farm workers. So here's kind of just an equation that I think helps me understand this sometimes. So we took the Census of Population, the total number of farm workers, and then we multiplied it by the relative proportion of workers by farm type, which is from the Census of Agriculture. And then we get the number of workers by farm type. That's based off of the Census of Population. The second step is to estimate the number of workers who are at risk of exposure. And here we pulled from 2 main data sources. So pesticide labels. These are legal documents that specify how pesticides can be used in Canada. So I think I kind of alluded to this earlier. It's what crops they're allowed to be used on, the type of equipment that you're supposed to use, how you dilute it, number of time or frequency of application, that kind of thing. And so we use pesticide labels to identify which pesticides were registered for use on which crops. We also use the Census of Agriculture to get the percentage of farms applying herbicides or fungicides by farm type. And then to combine these 2 data sources, we had to make some assumptions. So first, we assumed that farm types only grow the crop that they describe. So for example, that if we're looking at a wheat farm, they only grow wheat. We also assumed that if the pesticide is registered for use on a specific crop, it is applied. So if 2,4-D is registered for use on wheat, that it is then applied to wheat farms. Yeah, and so I guess I just wanted to highlight this because by making these assumptions, our estimates, they do represent the upper limit of exposure, because we're saying that if it's registered for use, it is being used, but there are actually a number of other pesticides that are registered for the same crops and the same pests. But these are some of the highest selling and highest used pesticides in Canada. So we think that like it isn't as big of an issue. And so here is another little equation for you. So for farm types for which the specific pesticide is registered, we took the number of workers by farm type. We multiplied it by the proportion of farms applying herbicides or fungicides by farm type. And this equaled the workers who we considered at risk of 2,4-D, glyphosate, or chlorothalonil exposure by farm type. For our third step, we assigned likelihood of exposure to the workers who had been identified in the previous step. So for this, we pulled data from the United States Department of Agriculture, the National Agricultural Worker Survey, and it collects information on hired workers' main tasks and crops worked. It also collects information on whether or not they had mixed, loaded, or applied pesticides within the 12 months or the 12 months preceding the survey. And so we got data on the tasks and crops worked, as well as the pesticide application status from 2002 onwards, just for the more northerly regions, the Midwest and Northwest regions. So that's a bit more applicable to Canada. And so we took this data and we calculated the relative, calculated the relative proportion of workers doing the different tasks by crop, and then applied it to the number of workers who are at risk of exposure, so that we could classify them into or divide them into mutually exclusive groups. So we considered workers who had mixed, loaded, or applied pesticides in the 12 months preceding as exposed. Those who primary tasks may have led to dermal contact with the treated crops were considered probably exposed, and then all other workers we considered possibly exposed. Okay, and then step number 4 was to assess exposure among agricultural workers with missing information. So something I didn't tell you before is that the Census of Agriculture does not include some workers. So it excludes contract workers and also workers from the industry support activities for crop production. And so, of course, these individuals could still be exposed to pesticides. And so we tackled them using our, I guess I like to call it like our traditional CAREX approach, in which we identify the occupations and industry intersections of interests, and then we assign a proportion of workers exposed. What informs this proportion is usually an environmental scan. We look through the literature, maybe connect with agricultural extension agents if necessary, and then we make a call that way. Okay, and so now we're on to our third and final question. What percentage of agricultural workers do you think were exposed to glyphosate?
Sorry, I was on mute. It's launched.
Thank you.
And people are thinking.
Need 8% more.
Getting close. Last call.
There you go. Perfect, thank you. Okay, so looks like most of you thought 11 to 13, followed by 15 to 18. So interesting, let's X out of that. Let's go to the next slide. So you guys were correct. We estimated that 11 to 13% of agricultural workers were exposed to glyphosate. So here I have just our overall findings. The lower estimates, those are the ones that are based on the census of population. The upper ones are based off of the census of agriculture. And we kind of just see some trends that we were expecting. Glyphosate is the most sold herbicide, so we would expect that exposures be, or the most number of workers be exposed to glyphosate, followed by 2,4-D, and then followed by chlorothalonil. I guess it's interesting to see the discrepancy between the lower and upper estimate, and we know that this is due to those seasonal, temporary, part-time workers. And I think this has important implications because, like oftentimes, these seasonal workers are migrant workers that are already employed under precarious conditions, and that they also have to face issues of like language barriers and power imbalances and that kind of thing. So just something interesting to see and like to consider moving forward when looking at exposure, potential exposure reduction programs or initiatives. when looking at these results, they do fall within the range of what was seen in Costa Rica and Nicaragua in those CAREX systems, where they found the percent of workers exposed to various pesticides, they range from 1 to 13%. So we're happy to see that, like, our estimates, they make sense. They don't seem totally unreasonable here. Interestingly, in Panama, the exposures were a lot smaller. They did look, or the methods were quite different, but they found that 0 to 4% of workers were exposed to the various pesticides that they looked at. But of course, this varies because based on the crops that are grown in the various countries, pesticide application trends, and also, oh, I forget what I was saying. I guess, oh yeah, also that they're looking at different industries. So in the other CAREX systems, they're looking at all industries, and we're just looking at agriculture. So we would expect our values to be a bit higher here. Okay. And then here, I have results for the top 5 industries by pesticides. And again, these are the upper estimates, so the ones based off of the Census of Agriculture. And I just wanted to point out a few things. So these are taken directly from our website, if you want to take a look. But what we're seeing very much reflects what the registered uses are of the various pesticides. So for glyphosate and 2,4-D, we're seeing more field crops, but for chlorothalonil, it's not. I also wanted to point this out because you'll see that some of the values are kind of similar. So for glyphosate and 2,4-D for other grain farming, the number and percent of workers exposed are the same. And that's because of the assumption that we made that if the pesticide is registered for use, that it is indeed used. And then we're using that same proportion of farms applying herbicides from the Census of Agriculture. So that's kind of why you're seeing that. And again, it's important to know that when looking at these estimates, because these are showing the upper extent of potential exposure. And then here we have data by province. Yeah, it's kind of fun to see like what the different crops have grown, how it's reflected in this graph. So for the provinces, we are seeing that glyphosate and 2,4-D, the percent of workers exposed to those 2 pesticides is much higher than to chlorothalonil. And that makes sense because they mostly do grow field crops. That's the emphasis. But in other countries, in provinces, like PEI, New Brunswick, where there's a lot of potato grown, we actually see that chlorothalonil is a bit higher than, exposure to chlorothalonil is a bit higher than 2,4-D, and that's because chlorothalonil is used to control potato blight, which is the fungus of the potato. So it's fun to see. Okay, and some assumptions worth mentioning, some other assumptions worth mentioning. The first 2 I touched upon earlier, so I've kind of lighten those up. We don't have to pay attention to those anymore. But another assumption is that we assume that some animal farms do grow feed. So with the data that we got from the Census of Agriculture, it wasn't apparent what the animal farms were growing, but we know that often they do grow feed. It's cheaper for them to grow their own feed than to buy it. And so what we did was we did some background digging to look at crop production practices in Canada and animal husbandry practices, I guess. We connected with agricultural extension agents to try to get a better idea of the likelihood of farms growing feed for the various different types of animal farms. And then we used similar approaches, a similar approach as to what I had described earlier for the crops. Another factor that I just wanted to bring up is that our likelihood of exposure was classifications. They were based on workers' main tasks. So the National Agricultural Worker Survey, which we based the task data off of, that does ask for workers' main tasks. And so there's room for exposure misclassification there because there could be other sources of exposure, but we had to narrow it down somehow. So we did it like that. And then finally is that the task data is specific to hired labor, to hired workers. But we did apply it to the farm operators that were captured in our data. And so again, there's a bit of wiggle room there. You would expect that farm operators might be applying pesticides more than hired labor. And so we might expect that the estimates would be a little bit higher because of that. And so moving on to implications and next steps. So this was the first attempt at estimating population level exposure to pesticides in Canada. And we did this by drawing from publicly available Canadian data and from the US when needed. We found that there were potentially significant exposures to pesticides in Canada. And again, many of these are seasonal and temporary workers who are already maybe in precarious conditions or work settings, I guess. These estimates can be and should be refined as more detailed data become available. So I didn't show the numbers for the number of workers probably and possibly exposed, but these actually are, there are quite a bit of them. So of the workers at risk for glyphosate, I think maybe 60% of workers were considered possibly exposed. So we just need more information to be able to understand what's going on and what the potential routes of exposure are and what's happening. But it's nice to be able to have estimates now, so we have some sort of idea of what's going on and areas where we can improve. We can apply these methods to estimate exposure to other pesticides. So I think this is something that will be interesting to see how this applies to other pesticides, especially ones that are less commonly used in Canada. It'll present interesting opportunities for how to improve the methods as we work through that. But overall, our next steps are just, we're looking to share these estimates and methods more broadly and to see how we can grow this research moving forward. So I want to acknowledge first our funders, who are the Canadian Partnership Against Cancer, as well as the study team, and again, the Pesticides Advisory Committee, without whom this work would have been very difficult. So it was amazing to have these folks help us out. And then here are the references. I'll leave it up for just a minute. And then, yeah, I guess we can move on to the question period. If you need to reach out to me for anything, feel free to email me.